The United States healthcare industry has been a topic of conversation across the country this week following the murder of UnitedHealthcare CEO Brian Thompson. Here to discuss healthcare, chronic pain, and the impact it can have on mental health is the CEO of Jackson House, Dr. Bruce Figuered. Good to see you, Bruce.
Good to see you again.
Happy holidays, Merry Christmas week.
Thank you.
All right, so this is interesting, chronic pain leading to mental issues.
Yeah. So if you think about chronic pain and the impact on one's life, I mean, it can affect many, many different components of a person's life, from their ability to work, to their ability to engage in recreational and social activities like they did before. It can also impact their desire, the amount that they spend in social situations with their friends. And so if you have something that impacts that many spheres of your life, or that many areas of functioning in your life, then it can oftentimes lead to symptoms of depression. In fact, about 20 to 25% of all people with chronic pain I'm sorry, 45% of people who have chronic pain also have a co-occurring mental health issue, such as depression or anxiety. So almost half of those people.
Well, when you have chronic pain and you can't treat it, and it feels like there's no way out, that doesn't sound like as much of a surprise.
Yeah, it doesn't. And with a lot of people where there isn't necessarily a pathway for it to be treated by surgery or some other sort of thing, it can also lead to somebody taking pain pills. And if you take opiates over an extended period of time, the likelihood of somebody becoming addicted to those opiates and developing tolerance to it, where you have to take increasing amounts of the medication, goes up over time. And so it's really important for people, if they're in that situation, to seek out help. If they're having mental health issues as a result of their chronic pain because it's impacted their life in so many ways, or if they've been on pain pills for an extended period of time and they're starting to develop tolerance to it, where they have to take more and more of it, that can be very, very dangerous. So it's important to see a pain specialist, and then also, to seek out help from a mental health provider if you're noticing symptoms of depression, chronic feelings of sadness, withdrawing and isolating more, feelings of hopelessness or helplessness, like nothing's going to change in my life. It's really important that you seek help.
But this guy who's accused of killing the healthcare CEO, there's no indication that chronic pain had anything to do with what was going on in his head, right?
No, but there wasn't any indication that he had a mental health diagnosis. There wasn't any indication that chronic pain was the cause of him, committing this heinous and awful crime. What we do know, based upon what I've read and what's been in the news, is that after this injury, he couldn't do many things in his life. So his roommate in Hawaii, as an example, reported that he tried to go surfing and then he was in bed for a week. And so he had a surgery, we know that, and then he completely shut himself off to the world. He isolated, he withdrew, and then during that time of isolation, he wrote some things and posted some things on social media that were somewhat indicators that something might be going on that's very serious, and then he committed that horrible act.
Yeah, so there was a mental illness.
It's possible.
Some kind of condition.
I mean, it's possible that something will come out, but nothing's really been said about that.
So if somebody is experiencing chronic pain, and it's effect, they should, if I heard you correctly, you should seek out
from a pain specialist, because the pain specialist will have interventions that are, like non-narcotic or non-opiate, sorts of interventions for chronic pain. I had a patient in my practice who had chronic pain for an extended period of time and suffered from it for years and years, and then went to a pain specialist and then got a STEMS device, where it's electrical stimulation, and it relieves so much of the pain that the person was able to successfully come off of those drugs and off of those opiates. And then when you take opiates, it also impacts your life. And so you have the chronic pain that impacts your life, and they have opiates, which have all sorts of side effects and potential dangers, and that also impacts your life. And so it's sort of a cascade of negative things that can happen.
So if somebody has chronic pain, they go to the doctor, they get treated there. Would the doctor necessarily refer them to a mental health specialist?
Yeah, sometimes they do.
Or would they have to do it themselves?
Sometimes they do. They don't always, and they don't always screen for a mental health issue as much as maybe they should. And so if somebody is needing help, I mean, they can obviously seek out services by giving us a call at Jackson House, or reach out to their individual provider and ask what kinds of mental health or addiction services are available.
Okay, Bruce Figuered.
Awesome.
Thanks, man.
Thanks. Good to see you again. Happy holidays.
You too.